I learned a new term this week. That's thanks to Montreal Gazette health reporter Aaron Derfel, and that term is boarding. The only boarding I knew was the kind that happens in hockey games, but that's not what he was talking about. That's when hospitals leave patients on stretchers while they wait for beds to free up. It might seem reasonable to maybe wait a couple hours for a bed to free up. Earlier this week, the average wait time for patients at the Lakeshore General Hospital was 30 hours. Many, if not most of those patients languishing on stretchers in the ER were in their 60s, 70s, 80s. Some of them have various degrees of dementia. So how does this impact their mental health? To just be laying there for 30 hours waiting for a bed to free up. You haven't even been treated yet. Here to shed some light on the situation right now is Aaron Derfel of the Montreal Gazette. Good evening, Aaron.
Good evening, Robin.
Now, I mentioned that average length time for boarding at the Lakeshore hit 30 hours earlier this week. Are we seeing something similar across other Montreal hospitals?
Oh, well, yes. I mean, it's not just the Lakeshore. Often the Royal Victoria Hospital is hard hit. You have the average boarding there at sometimes 39 hours. I'm looking at the latest statistics this afternoon, and I'm seeing it's not as bad, but you still have, for example, at Santa Cabrini Hospital in the East End, it's 27 hours and 18 minutes. And the effect of waiting like this is not harmless for some people. They can become agitated. In other cases, they develop a form of delirium. This has been studied, and that's why I wrote this column.
Absolutely. Specifically, if somebody is suffering from Alzheimer's or some sort of degree of dementia, it can be really confusing to have to lay there and not know what's going on. No one's talking to you. It's not uncommon in a hospital to go hours without somebody even coming over to see you. So it must be incredibly stressful. You referenced a study, and in your piece in the Gazette, you referenced one that was published last month in the Journal of the American Medical Association that looked at the impact that boarding has on people's mental health. And what did that study find?
Okay, well, the context is different because it's the United States, and they have their issues, but the ER situation is not as bad. But even there, they found that those experiencing delirium waited an average of 206 minutes. So, that would be 4 hours. And yet they found that they noticed that there was this higher risk. And but in Canada or certainly in Quebec, we're not talking 206 minutes. In some cases, you have people who are boarded for 5 or 6 days, and is this it's a question here of human rights. When someone is waiting that length of time, say 5 or 6 days, sometimes they don't get their meals. I've been told that this is the case. They can develop a painful bed sore. We heard of that case that happened in Saint Jerome, where this man developed a painful ulcer on his skin, and then afterwards he sought medical assistance and dying. So and received it. So what does that say about the state of our healthcare system? That people are there's this horrible psychological toll, and you do have this situation sometimes where they will restrain a patient. That means they'll put these restraints on their wrists so that they don't wander. That should be a last resort. But Quebec's ombudsperson found that this was happening excessively at the Lakeshore in Pointe-Claire. And why is it happening? It's because there are too many patients and not enough staff. And so they do it kind of preemptively. But again, it raises a question: if someone is waiting that length of time in the ER, they almost become like a prisoner of the system, and it becomes a human rights issue in my opinion.
Absolutely. Oh, that's heartbreaking. In conversation with Montreal Gazette health reporter Aaron Derfel, talking about the boarding situation right now in Quebec, specifically at the Lakeshore. How do we solve this issue? You mentioned that, these places are, these health institutions are chronically understaffed. And I think when we picture, we're waiting for a bed to free up, it's not always necessarily that we're waiting for a physical bed to free up. It's the staff that provides services for those beds that there isn't enough capacity for. Is that a fair assessment?
Yes, it's a collision of two forces. You have a shortage of medical staff, mostly nurses. So you don't have the staffed beds on other floors or as many beds on other floors to receive those patients, and that's why they're stuck in the ER. And then you have an aging population, that has more complex medical issues, and so this is just a recipe for disaster. There's something I just also forgot to mention. So, there's the psychological toll, but what has been observed, this has been studied, is the number of patients leaving emergency rooms without even being treated. They're just so fed up that has increased. Right? It was like 11% in 2023, 2024 of all patients who visited the ERs. Right? It's about 380,000 people. They left before receiving medical treatment, and some of them really need their medical treatment, and some of them end up going to hospital, and and this has been documented. They may suffer from a heart attack, and they may die. So you have this situation where people are leaving without ever being seen, and those who are remaining, some of them are developing delirium, and then they're being restrained. So it just underscores how serious it is. Now, the solution to this, obviously, would be to have more staff now, and they are increasing enrollment in medical schools and in nursing programs, but it takes a few years to train these people. So this situation is, in all likelihood, likely to get worse before it gets better.
Wrapping up with the Montreal Gazette's Aaron Derfel, if you have a loved one who's able to advocate for you, to notice that you didn't get your meal and to bring you dinner or to call over an orderly or something to make sure that they're getting fed, that's one thing. But I'm always thinking of the people who don't have adult children, who don't have a spouse or a sibling who can advocate for them. So what kind of recourse do they have? Is there somebody that they can talk to try and, get better treatment? Can they ask to speak to the ombudsman when they're in the hospital? What can they do?
Yeah, well, Robin, you hit the nail on the head when it comes to advocacy, and I've been told this by seasoned ER staff that it's good to have an advocate with you, a family member, to ensure that that you're taken care of properly, that you're not neglected. Again, this is, to me, it points to systemic neglect. There's no one out there doing this deliberately. People are acting in good faith. The ER staff are dedicated, but they're just overwhelmed. They're sustaining what's known as moral injury. They're tolerating what they don't have, what they should not have to tolerate under impossible conditions. And so, having a family member is there. The other thing you can do is what this family who's there was this patient who was waiting again at the lake shore. He was in his 80s, and he was suffering from severe chest pain. And he was speaking to his wife, and the only thing they would give him, the nurse gave him, was a Tylenol. He ended up suffering a fatal heart attack and was on the phone with his wife when he died. Afterward, they filed a complaint with the ombudsman. So there was there was consequences, and when the ombudsperson looked into this, they came across this issue of the excessive use of restraints. So that has put the Lakeshore on notice to improve their training and to end this practice of excessive use of restraints on patients. And they have it in the ER. They've had it for a couple of months. So there is that progress, and that there is some hope on the horizon.
Aaron Derfel is a must-follow on X, formerly known as Twitter. I still read your threads religiously, Aaron, and I appreciate you taking the time for us today.
Oh, well, it was my pleasure, Robin. Thank you so much.